Hello everyone, welcome back to my channel. Today our topic is about changes in pregnancy. Changes in pregnancy. What are the changes happens during pregnancy? So under this topic there are three main changes. So the first one is the anatomical changes, and the second one is the physiological changes, and the third one is the metabolic changes. So today we'll talk about two of these, that is anatomical and the physiological changes. So the first is the anatomical changes. As the word implies, anatomic means there's changes in the anatomical positions. So the number one changes is the, as you know, during pregnancy there is increased hypertrophy, increased hypertrophy and hyperplasia, in all the tissues, especially regarding to the reproductive organs, So what are these reproductive organs? This will be, first one is the uterus, second one is the cervix, okay, third are the pelvic veins and so on, okay, etc. So the number one is the uterus. During pre-pregnant state, that is before the pregnancy, or pre-pregnant state, your uterus is about 1 ounce, okay, but after the pregnancy, your uterus almost measures to about 1 pound. So why this is happening? This is all happening because of the hypertrophy and the hyperplasia of the tissues. So there is also in regard to the blood flow, during non-pregnancy or during pre-pregnant state, the blood flow to the uterus is measured to be about 50 ml, okay, but after pregnancy, the blood flow or the uterine blood flow increases up to 750 ml. So you can imagine it is almost 6 times or 7 times, okay, increase in the blood flow to the uterus. Second, under the uterus there is also formation of lower uterine segment. There is formation of lower uterine segment, that is LUS. Before the pre-pregnant state, your isthmus, if this is the uterus, so this portion is the isthmus, okay. So this is where the lower uterine segment forms. So before pre-pregnant state, the isthmus of the uterus measures about 1 centimeter. Oh sorry, not 1 centimeter, it is about 2.5 centimeter at the beginning of pregnancy. A term that is during pregnancy, it can measure up to 10 centimeter. So it is this place where the lower uterine segment formation occurs. So the uterus part is done. The second comes is your cervix. So due to increased hypertrophy and hyperplasia, there is increased vascularity as well. There is increased vascularity in the cervix. So what happens if there is increased vascularity? That is, if there is increased blood flow, which leads to your softness, which leads to the softness of cervix in initial stages of pregnancy. In initial stages of pregnancy, which is also known as the Goodell sign. If you have Goodell sign, if you have studied about the changes in pregnancy or the changes or symptoms, sign and symptoms seen in the first trimester, then you would know what the Goodell sign is. Goodell sign is, it is the softness or the pinkish color of the cervix during the initial stages of the your cervix. So third is the pelvic veins. What happens to the pelvic veins during pregnancy? What happens is due to the pressure of the gravid uterus on the inferior vena cava and the pelvic veins, in late pregnancy, tendency of varicose veins, and also edema occurs in late pregnancy. Not just edema, not just this, due to the pressure, due to this same pressure in the pelvic veins, your constipation is highly likely to develop during pregnancy. One more important point is the changes seen in the diaphragm. Your diaphragm happens to be at this place, okay? It is elevated. Your diaphragm is elevated up to about 4 centimeter in respect to the normal position. But this, however, later is compensated by the changes in the thoracic cage. Okay, so this was the anatomical changes. In the next video we'll probably see the changes in the physiology.